Well, nobody really, but
Oh, but here we are, huh?
well, it's setting up. This is as far as I've got, as furthest I've gotten.
Okay. Okay, Pearl, you're gonna have to skedaddle. You can take Mookie
There
next.
we are.
Okay.
Okay, I think I managed to make it work. That's
Yeah.
exciting.
Do you remember what you did for next time?
Yeah.
Yeah.
Okay. So now I'm gonna go to our Facebook page and I'm gonna say, sorry, we had to. We had to get it to work at, oops, get it to work on YouTube. Okay, can you still hear me okay, Betsy?
Yeah, I can.
Okay, great. Trying to not hear myself twice, so that's.
Yeah, there you go.
Okay. I think we just want to go for it, I think. And then I don't know if folks will eventually sign in, but I'm going to share our screen with the presentation on it.
Okay.
I have like so many tabs open from trying to figure all that stuff out. Give me a second to just close down some of these things and all right. I'll go back to share. Nope. Present. That's what I wanted. Present. Okay, present from slide one. Okay. Oh my goodness. Silly, silly. All right, we need to do a screen share. Well, that was exciting.
Mm-hmm.
The really exciting part is whether I'm going to be managing. Oh, there we go. Okay. Whether I can manage all of these different windows. As we say, technology is a new frontier for many people during this time, and we're all learning new stuff. So today I have learned a few things, even though we practiced and tested, and apparently we didn't test to the right spot. So I think we're good now. But now I want to make sure I can actually manage what's going on YouTube if anyone shows up here, which is the big challenge since I'm also trying to share my screen.
So if they participate through Facebook, it actually enters in through YouTube.
Well, so because of the technical difficulties with sharing our live stream from Zoom to our Facebook page, we could share it just fine to my personal account, but I don't think anyone's going to find you there. So because of the technical difficulties, I switched the destination for sharing. So it is
a workaround.
Yes, a workaround. That's right. So
But
I'm gonna.
Cat will win this game.
Well, okay, I see us now on YouTube. So on the off chance that anyone does come with a comment, I can try to answer it. Okay. Oh, now I have sound coming from over here. All right, so I think we should just go for it and talk about what we were going to talk about. And all right. So thanks for doing this. I appreciate it. I know this kind of conversation started several weeks ago. It feels like time has no meaning anymore. So maybe it was yesterday, maybe it was a month ago, but we actually started the conversation because we had some curiosities, or honestly, around Betsy and I had worked on a program called Ocean Friendly Housekeeping, and I think we did that last summer, 2 summers ago.
2 summers ago.
Yeah, 2 summers ago. And it was really informative. We talked a lot about how to reduce our negative impacts on ocean life through everyday household actions and detergent and cleaning products and all kinds of cool stuff up at Betsy's house in her commercial kitchen. And she was super gracious about letting us troop through her living room and her garden and even had snacks. So we started talking about bleach and the whole, I don't know, maybe it's a word, obsession. I'm not sure what the right word is.
Yeah.
With bleaching things and really, like, do we need that much bleach? Betsy's got a lot of experience in the medical field and trained nurse and teaches at the high school. And we had a lot of questions. And once the conversation started, we couldn't kind of stop it. We kept thinking about planning the program, and then we just get off on all these tangents and ask more questions. So that's why I'm here. It's because I have a lot of questions and I don't really know the answers to them, but we're sort of figuring our way through this, how COVID is impacting our environmental behaviors.
So, yeah, well, hello, everybody. My name is Betsy, and yeah, my current iteration is high school teacher. And I teach students who are interested in healthcare careers. And so not in any way ironically, but I've been teaching kids about hand sanitizing all year long. And we've also talked about how to make a bleach sanitizing solution, because we do some emergency preparation and working on, like, how would you set up a little field triage area, and sanitation is always a piece of that. But because I come to my career in healthcare from a pretty deep love of the planet and all the other creatures that we share this planet with, I just can't help but think, if we need more toxic chemicals in order to keep ourselves safe from a virus, like, how does that affect the rest of the world where we live? And what is the appropriate balance to strike between, like, keeping ourselves safe from a scary virus versus how does that impact other species that we share this planet with? So that's kind of the idea for ocean friendly housekeeping. And it seems really relevant again. I think that there's a lot of advice out there from the public health world telling us to improve our hygiene. And I don't know about you, but that is not really very specific directions. So clean, sanitize, hand washing, what is, like, how do you clean your surfaces? There's a lot of detail in there and a lot of flexibility too. Quite honestly, I think we're all going to be free to invent our own system moving forward, especially at home. So, one of the things I like to do is play around with words and think about where words came from. And so I think hygiene is a big word in COVID. And I mean, it's an old word. And I was kind of vaguely aware that there was some mythological reference there. So I don't know if you can see my screen or not, but I always like playing around with pencils and colored pencils. I don't know how this even looks, but anyway, Hygeia is a Greek goddess, and a Greek goddess of health. And so that reminds me of Hippocrates, and we are always quoting Hippocrates when we become healthcare providers, and we talk about do no harm. So that phrase came from the Greeks about the same time as the Greek goddess Hygeia was kind of a popular figure. no surprise, during some sort of a plague, people started worshiping health in a new way.
That's
Interesting.
interesting.
Yeah. Yeah. So do no harm to me doesn't just mean don't hurt humans. It means don't hurt the planet as well as we configure our response to healthcare situations. Yeah. And so it's just a lot of confusing information out there.
Well, and I totally appreciate that background. I think you know, obviously humans have been through situations like this before. We don't always have a great collective memory about how that's worked for us. But I'm not sure we've ever had the degree of variety of tools, as you point out, like the sort of we have to make our own best decisions. And there is a lot of choice, consumer choice out there about what works or we could select. And I know that public health officials have tried to provide some guidance on, you know, soap and water. Great example about how soap actually works on the virus and how effective it is. But I know that because it's something we can't see, a lot of times it feels like a real mystery, and you want to throw the big tools at something that you can't really see and you don't know where it is.
Yeah.
And so we maybe reach a little much for the things that are, you know, really like bleach, that are real, like, well, there's a tick, are we going to burn the whole forest down
Right.
to kind of control that?
Right.
So,
I mean, we've heard that talked about in many spheres as to whether the cure is worse than the disease. Right. So economically, the shutdown has that sort of an impact. But, you know, what are we doing to our environment right now?
yeah. Well, and so I was just going to say, one of the things that has happened, and that my big messy question was, wow, these plastic bags. So, you know, for a long time, like at Faro, I did a plastic-free January month years and years ago, and really at the beginning of sort of the thinking in the region about, well, do we need these plastic bags? What other plastic can we get rid of in our daily lives? And where does all this plastic go? And there's so much research now on how terrible plastic is in our oceans. And I know my shopping habits changed a lot at the beginning of March, as we were, you know, going into the sort of stay at home, stay healthy. And we did a lot of grocery shopping. We didn't do a lot of other shopping, but the stores, a lot of them instituted a policy that says you couldn't use your reusable bags. Well, I mean, I've been using reusable bags for years. And so the amount of plastic that I'm bringing home now, that like QFC, which is a Kroger, you know, family of stores, has, I have so many plastic bags. And I just was like, okay, this isn't good, because the whole point of reducing plastic is that it has this outsized negative impact on the ocean. And now we're saying, well, because it's better for humans, like, well, it's still going to ruin the ocean with having all this plastic.
Right.
Of course, humans are dependent on the ocean too.
Right. But I think that the concern about a COVID infection is so prominent in our minds that something as far away as the Strait of Juan de Fuca kind of recedes into some sort of blurriness. It seems like. Yeah. Yeah. And I think hopefully, what makes me hopeful anyway, is that we will learn enough about this particular virus and this particular pandemic to be able to sort of be a lot more strategic about some of the solutions that we're recommending. And, you know, I came of age as a nurse during the AIDS epidemic. And when we had persons with AIDS in the hospital, we wore the full disposable bodysuit.
Mm.
And it took some time to understand exactly how that disease was transmitted and realize that that wasn't necessary.
Right.
That said, that was the beginning of wearing gloves all the time. When you thought that you might be exposed to any kind of body fluid, you're going to put some latex gloves on. And that is a permanent change that we saw that came out of the AIDS epidemic. And I'm sure there'll be some permanent changes that come out of COVID.
Right.
Wearing masks, I think, will be one. We'll be seeing people wear masks, a lot of disposable masks, pretty regularly. I don't think that's probably going to go away, especially in some settings. Yeah. So.
Well, and I think that's really important. The point you made about you know, at the beginning, what you do is maybe different than as you learn more. And one of the things that I've felt has been a fascinating piece of this experience is like we're watching science happen, and it's happening rapidly. You know,
Yeah,
normally science is it's a pretty slow process, right? People are worried about publishing in journals, and then people read their study in the journal, and then they comment or they try to replicate. I've read so many news articles about how researchers and doctors are just like the borders are opening up. They're not worried about publishing right now. They're
right.
racing to find solutions and understanding. And so in the last 2 months, like if you look at an article on what you should be doing from, you know, March 8th, and then you go to April 8th, and then you go to May 8th, and I assume next week, June 8th, it's
Right,
completely different. And
right,
unfortunately, because science doesn't usually operate this quickly, we have a lot of folks that are confused, right? Because first they say, you know, surfaces are bad and don't, you have to sanitize everything. And today they say, well, they're not bad. Well, really what's happened is not that the opinions have changed, but our understanding of the virus has improved. And so we have, like you're talking about, a better handle on what exactly is going to lower our risk,
right.
and what maybe is like at the beginning we had this big reaction and now is kind of superfluous as we go forward. And that actually gives me a lot of hope too, because I really want to bring my reusable mug to the coffee shop.
Yeah, and I think it's a great time to use our voices as people concerned about the planet to help shape the new normal, right?
Mm-hmm.
It isn't necessarily what we have seen the last couple of months, some of it maybe, but what new normal looks like is going to have, you know, that's when a consistent return to plastic bags, for example, would have a big impact if we
Right.
kind of allow ourselves to go back to that without
Yeah.
questioning it. Yeah.
Well, and you know, what's interesting is so I did hear from one of our members that uh, she's noted a couple stores have like Country Air in downtown Port Angeles doesn't give you, it'll give you they'll sell you a paper bag, but they've gone away from plastic for years now,
Yeah.
and it
Yeah.
doesn't look like they allowed this experience to get them back into plastic, which I really commend. Uh,
Right.
and then
Do they let,
others, oh no, go ahead.
well, I'm just curious, are they letting you bring your own bag? Because
I
I
I
think they
believe,
have you take paper or a box.
yeah, I don't know. That's a good question. I haven't, well, the last time I shopped there, I had so few items that I was able to just take them off the counter and put them in a bag I had.
Yeah.
I haven't done like big household shops there in a long time.
Yeah. Yeah. They have a
So,
nice supply of boxes. I think that's
mhm,
a nice solution just because it's not contaminated from my house and I can use it.
right.
You know, I use cardboard in the garden. So
Yeah.
that feels like a reasonable solution.
What
If,
I think that's also the way that Costco has continued to, you know, they don't do bagging really
yeah.
there. So they've also continued to provide those boxes to their customers, which is a great kind of
Right.
lower waste opportunity.
Yeah. Yeah. Yeah.
But I will say that that I guess Safeway originally had said, no, you can't bring your reusable bags now. And then after a while they said, well, you can bring them. We're just not going to bag your groceries. You have to do it yourself, which is fine. And I guess now they're kind of going even further away. But one of the important points that I always tell people, and it's more important now than ever, is you really need to wash those bags. Like
Yeah.
you can't just keep putting, you know, produce and meat and stuff in these bags and then just dumping them in your car and bringing them back to the store. Like they really need to go in the washing machine.
I'm the worst offender.
But I like to the point you're making about how do we not let this redefine normal for us, right? And how do we say, no, we really want to make a new normal, one that works for not just humans and public health, but also for all these creatures that we share the planet with, that we're interdependent with.
Yeah, it's a shared value system for sure. Yeah,
Yeah.
I think one of the things that has been the most frustrating for me over these last few months, and I imagine we all have our ups and downs, but when I find myself getting angry and frustrated, it feels, it just feels like as a citizen, I'm being asked to just be really passive and let everybody else do all the thinking, right?
Mm,
Just like sit tight and wait for some expert to decide what it is that we should all do.
right.
And I think that, I'm not saying that I'm unwilling to follow the rules as they come out. Like I'm totally on it and wear my mask and washing my hands. But
Okay.
I feel like the time for citizen science and for all of us to do some deep thinking about what is the right way to sanitize your surfaces, for example, is
Mhm.
going to be our work, and we can participate in that and not just wait for somebody to lay it out for us.
Yeah.
And I think there's thousands of tiny little decisions that we're all going to have to make, and it's not clear to me. For example, how do we bring students back to school in September, and what kind of hygiene are we even capable of instituting there? And
Right.
I think we all, it's a good time to start talking about that, even if we can't go back to school today. Uh,
Yeah.
Soon we will. So I don't know
Well,
what Pharaoh's feeling about that. How are you imagining your future? When
yeah, that is such a good question. I think everybody's kind of reimagining. I'm not sure what the right word is there, but rethinking or pivoting. That's such a buzzword. I don't want to use that one
Yeah.
either. But we're all kind of looking at our current business models and our ways of doing business and thinking like, okay, it's not mainly just about adjusting, although certainly there are certain businesses that maybe just need to space further apart or something. Um, but it's also about like, okay, what's the opportunity? And I'm super lucky that we were able to get some funding at the very beginning of this situation that gave us some thinking time and a little bit of privilege to say, okay, well, what does it look like for Faro? I happen to be in the office today because our internet's better here, not at my house. But the fact of the matter is, when we reopen, we're going to be probably one family at a time for the foreseeable future until we can be really clear about, we're not a big facility. And so if you're a larger aquarium, like a Seattle aquarium, you have an opportunity as a visitor to sort of social distance. Well, I'm not sure there's a space in our museum where you could be 6 feet apart from a stranger. And so we're going to probably be open 3 or 4 days a week in person, taking time slot reservations. But then what it also said to us was, well, we've been thrown into the deep end on digital, for which we had absolutely zero strategy. I mean, we have a social media strategy, but no digital strategy. And Tamara and Rachel and I have all learned, or in some cases, been learning on the fly. So, we've never tried to stream a Zoom conversation to any kind of social media platform. And we've never thought about Facebook Live from different locations. Once you get past a certain point on the peninsula, the mobile signals are terrible. And so you can't really go places and broadcast live. With like, we have some pretty old phones. All three of us have the same model of phone. It's probably, I don't know, 3, maybe 4 years old. So we've been thinking about this idea of being open online and then being open in person, and how we have a strategy for both of those things.
Yeah. Yeah. Wow.
And I just wanted to say, similar to that, along the waste reduction angle, Peninsula Taproom in Squim, I saw did a mug club. So it's basically like a mason jar, and you can take your beer to go, right? Fill up your pint jar, but then when you come back, they put it in their sanitizing machine, and they give you a fresh one.
Oh, that makes sense.
Yeah, and I was like, wow, I wish we could do that with coffee cups.
Right.
That
Sort
would
of like
be
dishes that you can take with you, and then when you bring it back, then you get a new one. And if
right,
you never come back, you never have to get a new one.
right. And I think enough people here go to the same coffee spots that wouldn't be. Obviously, it's more challenging in like a place that doesn't have a sanitizer, like a coffee stand. And so I'm not sure work everywhere, but certainly a cafe, that has dishwashing setup could facilitate a club of that kind.
Right.
And
Well,
it's an interesting moneymaker too.
if a club could go beyond the boundaries of just one coffee shop, then there could be a community-wide.
Oh.
That
See,
would
now that's another smart idea. Community-wide reusable coffee program. I love it.
Yeah. Wow. Wow. Well, I mentioned this article that I read last night, and I think it has a little bit of relevance here, Melissa. And this is Atul Gawande is a physician from Boston who is a writer for the New Yorker, and he's published novels, and he's a big name in sort of people who are thinking about how we provide healthcare. And he talks about his hospital in Boston and how successful they've been in basically eliminating infections between coworkers, right? So they're finding that they're not seeing a lot of transmission in the hospital from patients to workers or between workers. And they have instituted these 4, that's what this is, 1, 2, 3, 4 behaviors that they are being very strict about. And one is hand hygiene and also contact surfaces. So anything that it's like, what are their hygiene practices? They're also instituting not just temperature checks, but a screening tool. And they have an app. And this is why I thought about Pharaoh. This idea like you don't let anybody in who has a fever. And
right.
really, like, you're infectious way before you would get a fever. And so they have an app where you have to positively answer a series of like 6 or 7 questions. Do you have a runny nose? Do you have a cough? And you would have to basically lie to get through that screening tool. And then, it immediately, like metaphorically, but unlocks the door. Like you can walk to the hospital after you go through these questions to say, no, I don't feel sick. No, I don't have a runny nose.
Right.
So there's hygiene, there's the screening tool, there's social distancing. So they try hard to stay 6 feet apart from each other in the hospital and clinic setting. And then there's the use of the mask. And he describes it like a 4-drug regimen, and you need all 4 of those. But just how like successful it is, like those things are working. And so I think as we, as the rest of us figure out how are we going to behave post-COVID in our sort of public spaces and crowded lives and things like that, I imagine that these 4 will be what we're looking at. And how do we sort of adapt that to our own situation? It will be an interesting question, right?
I think, that's such good guidance too, looking at, like I said, science in real time, trying to look at what these natural experiments are. So what are people doing that's really working at preventing transmission? And I assume, I don't know, but one of the things that's been also interesting in terms of natural experiment is the just looking at the changes in our like our carbon emissions, greenhouse gas emissions, during the time that many people were staying home, businesses were shut down, and all across the world, and what that means for climate change. And I know there's so many groups interested in that question about how do we reduce these emissions, and that seemed to be sort of this everyday way of life. But if we can take a crisis like COVID and say, okay, this is what's working to reduce those emissions, and we can look at something analogous like a carbon or transmission, not emissions, transmission, and look at something like carbon and say, okay, well, what's happening with carbon right now when these businesses are closed? And what does that mean for what we could do afterwards to keep those reductions happening?
Yeah, this is an interesting slide for sure.
Yeah, this is from the Washington Post. This article was on the 19th of May. And it basically, this is an average daily change. So at the bottom, you can see sort of the beginning of the graph is January 1st. And then there's a sort of not quite the end point. It takes you through the April 7th date. And so you can see that certain things like residential, because many more people were staying home, went up slightly, but almost every other major sector went down. And I think, as we look at ways to keep ourselves safe and to prevent these transmissions, one of the things that research is showing is that kind of being in these enclosed spaces for long periods of time without certain kinds of air circulation are problematic, and may, if you don't have mask or you really haven't stayed home when you've been sick, then could increase the risk of catching COVID. And what does that mean for, say, buses, for our continued reliance on home delivery? Are we still going to get on an airplane? So a lot of these things have longer term environmental impacts. And now is a great time that the kind of leaders in these sectors could also be trying to reframe the question to say, well, if this major worldwide event has only reduced our average daily emissions by 17% across all these sectors, which really only brings it back to 2006 levels, we're going to have to work really hard in the future and have significant rethink, like they are at that hospital, to figure out how to manage it.
Right, right. Well, especially because when you think of it, did we really decide to stop traveling, or are we just waiting to get back on that next airplane and you'll see a spike, a surge? And
yeah, well, that's what they're seeing in the countries, mostly in Asia, that have been opening up again, is a huge increase in purchasing automobiles versus, say, taking public transportation.
public transit. Yeah.
Yeah.
Interesting. Huh.
So,
Wow. Wow.
well, and I know that also there's some personal messy questions too, right? So obviously we have a million decision points we want to make about how we, clean our homes and do it in a way that cares for our fellow animals on the planet, and how we do our individual behaviors. But I know that you had a messy question about just like a basic human connection.
Oh, what was my messy question? Yeah.
You hugged your mother-in-law.
Oh,
What did you decide?
I hugged her.
Yay!
I wasn't even sure. I got out of the truck. My husband and I both, actually my mother-in-law, and she's 87. She lives by herself in Seattle. She's amazing. She just never seems to miss a beat.
Yeah.
And I haven't seen her since February. And we went over there for Memorial Day, just for one day. We drove over there because she wanted to go up to Camano Island and visit someone. So we took her on that outing. And I read a lot about this sort of choose your tribe and who do you include in your bubble. And I guess I just decided she has to be in my bubble.
Yeah.
And I don't know when it would become fine. So yeah, hugged my mother this weekend.
Oh, that's good.
We wore masks, but I have to say, wearing homemade masks is not easy. And I here she is. She's in this little slide here in the corner, and it's cute as a button. But she made herself a mask, and I don't know what happened, but it's probably 6 inches too long for her face, and it just would kind of hang down. Yeah, there's a lot to it. It's not easy to follow some of these rules and to actually have a mask that fits and is enough that you can wear for hours at a time. Takes a lot of doing and a lot of commitment to it. So, but yeah, we did.
Well, I'm glad. I know you were kind of thinking about that a lot.
And it's a double-edged, it's two-way, right? Like, I don't want to be the reason why she gets sick.
Right.
And we all have to assume that we're currently infected because we wouldn't know otherwise. You might not have symptoms. And I don't want her to get sick, but I also don't want to be the person that brings COVID back into Clallam County and adds more cases, even if it's me and I don't get that sick.
Right.
I sometimes think that humiliation scares me more than death.
It can be pretty painful.
I know. And so I don't want to be that person. So
Yeah.
I have been very good about sequestering myself, but I suspect that everyone is making decisions, something like that.
Yeah.
There, right? We all have to draw our own line.
Well, that's it. I think that we are all kind of in the same place around that. Like you said, a million questions, and always thinking you know, one day you get information from one source and 2 weeks later, the information is going to be
Yeah.
probably different, right? Because that's how it works. That's how this process works.
Yeah. Well, and if I can say differing information, because this always comes back to bleach for me, or it starts with bleach. So I didn't want to do this in the kitchen, but so I have some liquids here. I don't know if you
Oh, here,
can see it or not.
let's get rid of this slideshow and just focus on you.
First off, okay, bleach.
Okay, there we go.
Bleach is sodium hypochlorite. So actually bleach, when you look up the word, it's a verb. It means to whiten. I think there's probably some racial overtones going on here, but the word bleach does not mean this. This brand name.
Gotcha.
Clorox bleach, and it has chlorine in it. There are non-chlorinated bleaches, and that's not recommended. So anyway, this is your basic bleach. I have a gallon of it because I have a commercial kitchen and I use it because I have to, right? It's part of a commercial kitchen license.
Right.
But measuring out the right quantity is really tough. So when you're a food processor, they tell you to sanitize all of your countertops and dishes and everything that you're washing with 1 teaspoon of bleach for a gallon of water. So mixing up a gallon of cleaning sanitizer is appropriate in a commercial kitchen setting because you're going to be using it. Like, or maybe you're filling a sink, right? And you got a 3-gallon sink and you put 3 teaspoons of bleach in there. Well, in a home setting, who needs a gallon of sanitizing liquid? And just so you know, it's only good for 24 hours once you put it in an open container.
Yeah.
And so if you've got it in a jar, or like, again, it's just so confusing. I have a lid on this. Does that still qualify as
right? Yeah.
No, but you're supposed to make it fresh every day.
Oh.
So I guess my take-home message here is to minimize the amount that you make.
Right.
Okay? So when I am sanitizing, this is my little squirt bottle here. I only want about a cup of the solution, of the solution. That's way more than I need for a day.
Yeah.
I don't know how much cleaning you guys do, but that's more than enough.
No, at home, that's about right.
Yeah, right. So you got to do a little bit of math to bring that quantity down. And I keep looking around here distractedly because I have a spoon and a syringe somewhere on my desk.
I was going to say, how are you measuring if it's a teaspoon per gallon? You have to do it in like cc's, right?
Yeah, exactly. Like, and even that, like 1 cc is about enough for a liter of water. I'll just say that. Darn it, I'm so spacey. Where did it go? Melissa, I had it. You know I had it. I had a spoon and a, oh, here it is. I got it. Okay. All right. This is a 5 cc syringe. Okay. So if you can measure that pretty small, right? So you would want to have, and at 5 cc's is a teaspoon. So a teaspoon per gallon. If you only want a cup, you need a 1/16 of a teaspoon.
Wow.
And of course, the math doesn't work out that well.
No.
Right? How do you get a 1/16 of 5?
And I don't know about you, but I don't actually have a syringe lying around my house either.
But,
I mean, I maybe could come up with an eyedropper.
Because I'm a high school teacher. And
right.
Health sciences. I know these are not easy to come by. And so, yeah, the point is, it just really takes a tiny little bit, right? Like not even a dip of bleach, probably enough to get you.
No, I see. Okay, so here's a question. Did you pour bleach from the gallon into the pickle jar?
I poured it into the small jar.
Yeah, so it would be easier to get a little bit out of it.
Right, because
yes.
How the heck are you going to get a 1/16 of a teaspoon out
No, I was actually just wondering, I don't know, that's probably not a new container, but the other day I opened a container of Simple Green to clean my kitchen cabinets with, and it had a foil lid on the top of it, and we just poked a little hole in the foil.
Oh.
So I assume if it was similar on the bleach, you could maybe just fit your eyedropper in there or something. But I like this idea of putting it in a smaller jar.
Well, I don't know, maybe having a pump on it. But and they tell you don't put it in an unlabeled container. And I would emphasize this really seriously. Like, I drank bleach one time because it was sitting in this water bottle and I didn't realize it, right?
Yeah.
So you have to be very careful. And this is a homemade label that it's getting kind of hard to read, so you can't, but it actually, I wrote the poison control phone number on here.
Oh,
And
smart.
when you have kids or animals, like, this should be up. It should not be under your counter.
Yeah.
It should be up out of the way. And you need to say, this is bleach on it.
Yeah. Bad. Don't drink.
Yeah, don't drink. I mean, and it smells horrible. And, I was doing a little reading, and children usually, if they're going to sip on that, they're not going to swallow much because it tastes so
Tastes so
terrible.
gross. Yeah.
So, real bad injuries from kids drinking bleach are not common.
Yeah.
They might get a burn in their mouth for the
Yeah.
most.
But I think that just goes back to this whole idea of, using it in the right way means that we're using it in a way that is appropriate for the environment.
Yeah.
And so storing it properly, the whole kind of like respecting the bleach.
Yeah, it's a serious chemical. Yeah.
Yeah.
And so you want to keep yourself safe from it.
Right.
Like, I feel like I got it on my hands right now, and I'm just wanting to go wash it off. So
Yeah. Well, we probably do have to wrap it up anyway,
Okay.
so we can get your hands washed. But I think there's a lot more of this same kind of stuff out there, trying to figure out like what, if I'm going to be healthy and keep my family healthy, what kind of decision should I make under this circumstance? So I'm
Right.
glad that you actually brought the bleach up, because that was kind of where this all started. And I know we're
Yeah.
going to have more questions like that going forward.
So less is more on the bleach question. And you can get little strips so you can test whether you got the right amount or not.
Oh, yeah.
Yeah.
Yep.
So, but it's not as simple, right? Like, the directions, the sound bite simply says use bleach to sanitize, but
Right. Not how much you should use. And yeah.
not very much.
Well, I, for one, am going to give the reusable bag thing a go this week when I do my grocery shopping. I probably can't go to Kroger because they won't let me use them, but I will figure out a place to go and do my grocery shopping so I could get back to that. Reclaim that preference. And I know we're going to maybe try this again next month. So this was a great pilot experience, and unfortunately, Facebook was not cooperating. But we'll come back next with more messy questions that we could try to figure out.
So this was fun, Melissa. I look forward to chatting
Thank you so much.
from my couch to yours.
I know, right? From my lovely filing cabinet arrangement.
Right.
We don't
Actually,
have a great aesthetic in the office.
I can't work at the school anymore.
I know, that's a bummer.
I'm just planning outdoor curriculum. I think being outside might be the best moment for outdoor education that we've had.
Well, there's certainly some great ways to get out there right now. The weather's been good. So,
Yeah.
all right. Well, thanks for participating in this, and we will see you again pretty
Okay.
soon.
Bye.
All right, bye.
Okay.